I am Dr. Sharjeel and you are watching my YouTube channel. If you like my videos, don't forget to subscribe my channel at the end. Now today we will solve the ophthalmic sign 121, and we have already discussed this case in one of my academic WhatsApp groups, and Powell Coleman diagnosed it with perfection. So I have shown you a middle-aged male patient who had road traffic accident one day back, and now there is a swelling in the upper face, in lower eyelid and inferior orbital region on the right side. When I palpated it, I felt crackling sound beneath the eyelid skin, which is typical of cutaneous emphysema. Now this cannot be explained in words, and only on touch you can remember exactly how cutaneous emphysema feels. So there are some things which you can diagnose on touch. When the surface of the skin is touched, you will feel the distinct crackling sound called crepitus. You can also hear it faintly when you are close to the patient, but feels distinctly. Now why emphysema, cutaneous emphysema is formed? We all know that we have got air-filled paranasal sinuses in our face, to name few: ethmoidal, maxillary, frontal. So when there is a trauma to the face, there is a fracture of orbital bones, the air from these sinuses escape and is trapped in the subcutaneous layer of the skin. We have got three layers of skin: epidermis, dermis and subcutaneous. So it is in this subcutaneous layer of connective tissue where the air is entrapped, and like here, in this case, it is usually inferior eyelid cutaneous emphysema, and when you feel it, you will definitely feel that air. The entrapped air will give you a crepitus sound. Now another variant is orbital emphysema. When the air is entrapped in the orbit, sometimes it becomes dangerous if the cause is not treated, and it can cause compartment syndrome very rarely, and optic nerve compression. So when such is the case, decompression by needle aspiration is required, or sometimes when it is causing proptosis, then lateral canthotomy and cantholysis can be done. But usually, mostly eyelid and orbital emphysema is a self-limiting condition and requires no treatment, just symptomatic treatment. And mostly the important thing is, whenever you get cutaneous emphysema in the orbital region, you should rule out orbital floor fracture, because mostly it is associated with orbital floor fracture. So whenever you get cutaneous emphysema, you should check in ophthalmos, diplopia, double vision, restricted extraocular movements, especially vertical, teardrop sign on CT scan, to rule out orbital floor fracture. Now what are the other causes besides trauma? Other causes are forceful sneezing, straining, blowing nose, weight lifting and coughing. Sometimes spontaneous emphysema do occur. So let's come to our patient. Now this patient had a 6/6 vision, luckily with full mortality. There was no diplopia, intact orbital margins, so no orbital floor fracture associated, and it was a mild cutaneous eyelid emphysema that will resolve on its own. But I thought I should clear your concept regarding eyelid orbital cutaneous emphysemas, and I hope after watching this video, and if you like this video, I have got hundreds of thousands of such videos on my channel, and you can also search those. Thank you for patiently listening me.